My name is Alison Wang, and today I will be presenting about the benefits of the use of large language models to improve ER overcrowding and triaging. But first, let's start with a bit about me. I am Alison Wang, and I'm a rising senior at Columbus Academy, which is in Columbus, Ohio. In my free time, I like to play piano and violin, and I also dive. In school, I founded the Columbus Academy Medical Professionals Club, also known as CAMP, which informs students about medical career pathways and opportunities. A large part of my life is my role as co-program director of Columbus's Acing Autism, which provides children who are on the autism spectrum an opportunity to learn the fundamental skills of tennis. This summer, I'm a research intern at Nationwide Children's Hospital, where I get to learn more about virology. As for my interests, I'm interested in optometry, pediatrics, and also public health, and I would like to continue to develop my Spanish language skills going forward. Now, to speak about the issue of ER triaging, let's first define some terms. ER overcrowding is when the number of patients exceeds the treatment space capacity. In other words, there are more patients entering than can be treated at any given time, which leads to longer wait times, delays that especially affect those who require greater urgent care, decreased patient satisfaction, and decreased quality of the healthcare provided, while at the same time increasing costs. This graph provides a bit of data to show that wait times have increased over time, and as the issue gets worse, it will only continue to increase. So triaging is the process by which patients are examined and basically ordered by severity. Emergency departments and nurses tend to use the Emergency Severity Index, which is a scale that has 5 levels, with 1 being the most immediate and life-threatening, and 5 being the least urgent and treated as time permits. An example of triaging is comparing a patient who broke their leg compared to a patient who has a cold. Both are ill and need to be treated, but the person with a broken leg should be prioritized due to the higher level of severity. This would be a triage that the nurse can make. In a sense, triaging is a way of emphasizing the notion of equity over equality. Now, why is all of this important, and why is it important to global health? Well, emergency departments worldwide are experiencing overcrowding at an extreme rate, especially since 2020 due to the COVID-19 pandemic. This, in turn, affects the triage process in that the patients enter at a faster rate than the nurses can triage. And with the pressure of this rapid rate, combined with the uncertainty of the arrivals, the triage process is subject to human biases. The effect of this is inaccurate triaging in two forms. The first is under-triaging, which is the case in that the patient's condition is underestimated, meaning they were examined to have a lower severity than they should have had. The other case is over-triaging, in which the patient's condition is overestimated, so they were labeled with a higher severity than necessary. So how can we fix the issue? Currently in the ER, a triage nurse will screen each individual patient in order to direct them to their appropriate treatment area. This is not only time-consuming, but it also introduces the factor of bias, which could lead to further inaccuracy in triaging. So, instead, an aid to this ER overcrowding crisis could be the implementation of a large language model, or otherwise known as an LLM, into the triage process. An LLM is a form of AI, like, for example, ChatGPT, Cloud, Gemini. An LLM could assist nurses by significantly decreasing the time it takes to triage. And it could also assist physicians by providing tools to treat patients with urgent needs. This is just a model, but you may ask, how could we implement this idea into real life? Well, the LLM can complete the triaging process by using the patient's provided information to return their level of urgency, which is usually based on the ESI, which is the one with 5 levels I mentioned earlier. In order for it to even begin this process, however, it will use data from ERs all across the United States to create algorithms for triaging. Therefore, the process can be more efficient and accurate compared to human triaging. However, AI won't completely replace humans. It can work independently while also being monitored by a nurse or clinician. This is so that if there are any errors or necessary fixes, the clinician will be able to respond quickly. So now let's talk more about the benefits of using LLMs. First, there's scalability. This means that multiple patients can use the model at any time and can handle varying patient volumes, which ultimately streamlines the process. This helps triage nurses assess a patient's priority more efficiently and improves the hospital's ability to manage resources. This model is very scalable and it can be deployed in ERs across the country. Second, LLMs allow for improved triage accuracy because they will help accurately assess the severity of patient conditions due to being trained on extensive health records. This compares to the current triage process, which is more subject to human error. Third, it is known that humans have biases. The model can minimize the influence of these biases and reduce the likelihood of any errors in the triaging process. AI may have biases as well, but they are minimal compared to human biases, and implementing LLMs into the triage process will overall decrease bias and error significantly. Finally, the model provides an enhanced workflow that makes the triage process more efficient and less time-consuming for healthcare professionals. As shown, ER overcrowding continues to be a huge issue in the US. And with the time and pressure it takes for the triaging process, it can lead to inefficient and inaccurate treatment. By using LLMs, the process could be streamlined, which improves accuracy and workflow overall. While bias is inevitable, AI also reduces human bias and risk of error due to the training and algorithms based on data that it undergoes before beginning the triage process. And also, while the data that I compiled is based on the United States, LLMs can be used worldwide, and ER overcrowding is a huge issue worldwide. So, other countries can also implement LLMs, not only the United States. So these are the sources that I use for my research. And I would like to thank Anissa Mady, Catherine Colfrinch, and Tiffany Wang for assisting me in the research and development of the model. I also appreciate SlidesGo for providing some of the icons seen on the slides. And I'd also like to thank you for listening. I hope you were able to take something away from my presentation, and please reach out if you have any questions or would like to further discuss this topic. Here's my contact information. Thank you.